Well, a new study concludes opening an artery in the neck can significantly reduce the risk of having a stroke. News 4's medical expert, Dr. Peter Ostro, has more on that tonight.
The doctor puts a stethoscope on your neck to hear the flow of blood to your brain. If the artery becomes narrow, that could lead to a stroke. Here's a normal neck artery called the carotid. Notice how smooth its lining is. Nothing's interfering with the flow. But here's one that has become narrow because of atherosclerosis. You can see how narrow the channel is, right where the artery branches.
It happens to be a place where fatty plaques develop quite commonly. As the plaque in your neck enlarges, if it gets to a certain point, it is potentially going to cause a stroke.
Dr. Hopkins is chief of neurosurgery at Millard Fillmore Gates Circle. Surgery is able to remove plaques before they cause strokes. The artery is opened and the plaque inside is gently separated from the wall. After it's removed, the artery is closed. A recent study looked at more than 3,000 patients with narrow carotid arteries but no symptoms. Those who had surgery to remove the plaque had about half the risk of stroke as those who were just treated with medications.
Medications just don't work as well as removing the plaque itself. You know, that just makes common sense. And blocking the flow in a major artery to the brain is always potentially a problem.
Dr. Hopkins led a national study that showed placing a stent in the artery can work just as well as surgery.
Carotid stenting is equivalent to carotid surgery overall. And so we now have a wonderful situation where we have a choice.
The group at Gates Circle has the largest experience in the world at using both stents and surgery. They're equally effective, but some patients are more suited to surgery and some to stents, and that depends on what the vessels look like, but they can pick the right one for each patient.
Now, if your arteries can become narrow without causing any problems, how do you actually know it's happening?
Well, if there's a narrow spot in an artery, the blood makes a little noise as it flows through that spot, and you can hear that with a stethoscope during a routine exam. So then you have some more studies to see whether it's narrow enough to need to be treated, and you follow up from there.
All right, good stuff. Thank you, Doc.